Brain herniation is the shifting of the brain tissue from one space in the brain to another through various folds and openings. Brain herniation occurs when something inside the skull produces pressure that moves brain tissues. This is most often the result of brain swelling or bleeding from a head injury, stroke, or brain tumor. Herniation of the brain can also be caused by other factors that lead to increased pressure inside the skull. The 5 types of brain herniations include: 1. Subfalcine herniation involves the cingulate gyrus, which is pushed against the falx cerebri. 2. Transtenoreal uncal herniation involves the medial temporal lobe, which is often squeezed by a mass under and across the tentorium. 3. Central herniation involves herniation of both temporal lobes through the tentorial notch. 4. Atonsillar herniation is caused by an infradentorial mass forcing the cerebellar tonsils through the foramen magnum. 5. Upward herniation occurs when an infradentorial mass compressed the brainstem. Signs and symptoms may include high blood pressure, irregular or slow pulse, severe headache, weakness, cardiac arrest, loss of consciousness, coma, loss of all brainstem reflexes, blinking, gagging, and pupils reacting to light. Respiratory arrest. Because a brain herniation can be life-threatening, a speedy diagnosis is essential. To accurately diagnose a brain herniation, researchers suggest that healthcare professionals use an approach that includes getting a comprehensive analysis of the person's medical history and current symptoms, identifying the brain structure that's displaced to classify the hernia type, evaluating other brain structures for possible herniation. The exams and tests to determine a brain herniation may include any of the following: X-ray of the skull and neck, CT scan, MRI scan. Treatment is aimed at relieving the swelling and pressure inside the brain that's causing the brain to herniate from one compartment to another. Treatment may prevent further brain damage or death. While the cause of the brain herniation is being addressed, the person being treated may also receive oxygen, a tube placed in their airway to support breathing, sedation, medications to control seizures, antibiotics to treat an abscess or to prevent infection. To reduce swelling and pressure, treatment may involve surgery to remove a tumor, blood clot, or abscess, ventriculostomy, a surgery that places a drain through a hole in the skull to get rid of fluids, osmotic therapy or diuretics, such as mannitol or hypertonic saline, to pull fluid out of the brain tissue, corticosteroids to reduce inflammation, craniectomy, a surgery that removes a part of the skull to make more room. Usually, a combination of these treatments is necessary. Complications of brain herniation include brain death, respiratory or cardiac arrest, permanent brain damage, coma, death,